Hello, my dear friend. Today, I want to talk to you about something that might seem small at first, but trust me, it's bigger than we think. Tell me if this sounds familiar. Your doctor tells you to get some blood work done, so you jot it down on your to-do list like it's nothing. Go to the lab, get it done, move on, right? But what if I told you that what you do before that test could change everything? What if just one little thing, a sip of coffee, skipping a pill, a short workout could lead to a completely wrong diagnosis? You could end up thinking your kidneys are failing, your cholesterol is out of control, or worse, get put on meds you never needed in the first place. You see, my dear friend, these aren't just tiny mistakes. These are the kind of mistakes that mess with your life. And here's the kicker, over 70% of people make at least one of these mistakes before going to the lab. Yes, more than 7 out of 10. Are you sure you're not one of them? There was a gentleman I once knew who drank a small cup of coffee before his fasting test. Just a regular old cup with a dash of cream and sugar. That's it. And you know what happened? His blood sugar spiked so high, the doc thought he had full-blown diabetes. They were about to start him on meds, all because of a simple cup of morning coffee. My dear friend, what you do before your blood test can absolutely mess up your results, your health, and your peace of mind. And what's worse, nobody really tells you this stuff. That's why I'm here. In this video, I'm going to walk with you through the 10 most common mistakes people make before blood work, and how to avoid them like a pro. And that's not all. I'm also going to share with you 10 things you need to do after the blood test. Things that nobody talks about but are just as important. And I'll say this, there's one tip I'll only share at the end because it changed someone's life forever. So please, don't leave halfway. One sentence could be your turning point, or someone else's. And now, my dear one, before we dive in, I want to ask you 2 small favors. First, hit that subscribe button and turn on the little bell icon, so you never miss a single golden nugget we share here, because every day, I show up with love, with stories, and with real tools to help us older folks live better, stronger, and longer. Second, please tap that like button and type the number 1 in the comments to let me know you're here with me. And if you feel this message is important, share this video with someone you care about, post it in your WhatsApp group, the Seniors Club, maybe on Facebook, or to your close circle, because who knows, your one simple share might just help an old buddy who hasn't slept well in months, or a dear woman who's been silently struggling with shaky leg, or maybe a neighbor who's been lost in the fog of aging. Find clarity, hope, and strength again. Your support, my friend, is like a big ol' shot of energy that keeps me going. So thank you. And now, let's get to the part that could change the way you see blood tests forever. After your blood test, thing 1, don't rush to eat everything in sight. My dear friend, I know how tempting it is. You've been fasting for hours. Your stomach's grumbling louder than your neighbor's lawnmower. The moment you step out of that lab, every part of you screams, I need food now, and I get it. But hold on just a second. Let's not make a mistake right after we did everything right. You see, after fasting, especially if blood was drawn, your blood pressure may dip a bit. Your body's trying to reset. And if you dive into a heavy breakfast full of sugar, grease, or caffeine, you could feel lightheaded, nauseous, or even dizzy. Some folks even faint after scarfing down food too quickly after a blood draw. According to a study published in the Journal of Clinical Pathology, patients who consumed high-fat or high-carb meals immediately post-lab draw experienced delayed blood glucose recovery and increased postural hypotension symptoms, meaning dizziness when standing up. So what should you do instead? Ease into it. Start with a glass of water. Sit for a moment. Breathe. And when you eat, keep it light. Something easy on the stomach. A banana, some oatmeal, or toast. Let your body adjust gently, not all at once, because what's the point of doing everything right before your test, only to knock yourself down 5 minutes later? And my dear friend, if you've ever walked out of a lab and headed straight for a burger or a donut, you're not alone. But now, you know better. And hey, while we're here, if you're still with me, my friend, I'd love your help. Would you take a second to tap that like button? And drop a little I'm here with you in the comments so I know we're walking this journey together. And maybe, just maybe, share this video with someone who always skips breakfast and then eats like a teenager after lab work, because they might be walking right into a crash without realizing it. Now, what happens if you start feeling off a few hours after your blood test? Lightheaded, A little weird. That brings us to the next thing you need to know, and you won't want to miss this. After your blood test, thing 2. Pay attention to any weird symptoms afterward. Now listen, my dear one. Most folks walk out of the lab, jump in the car, and think, whew, that's done. But what if your body's trying to whisper something to you on the ride home, and you're not listening? Let me tell you something most people overlook after a blood draw, especially if you haven't eaten, or if your body's on the fragile side like ours tends to be at 60 or 70, you might feel things that don't seem like a big deal but could actually be red flags. A little dizziness, a wave of nausea, your hand feeling colder than usual, or a bruise that looks bigger than it should. My friend, these aren't just old age quirks. These are your body tapping on your shoulder, saying, hey, something's not right here. A report from the American Society for Clinical Laboratory Science found that nearly 15% of older adults experience adverse symptoms post-phlebotomy, some mild, others requiring follow-up, and yet, most of them didn't report it. They just brushed it off. But brushing it off doesn't fix what's underneath. What I tell my friend, and now you, is this: don't ignore the small stuff. If you feel lightheaded, sit down. If your arm's swelling, call your doctor. If you suddenly feel exhausted in a way that doesn't make sense, don't guess. Check it out. I had a neighbor once who thought the bruise on his arm was just from bumping into the door. Turned out, he had low platelets and the lab draw simply brought it to light. Good thing he followed up. He caught something serious early. So please, friend, don't wait till things get worse. And now, if anything I just said hit home, if you've ever felt a little off and didn't know why, let me know in the comments. Say, that's happened to me, so others know they're not alone. And hit that like button if you believe more people our age need to hear this kind of truth. Because up next, there's something you absolutely need to do right after your test, but 90% of people don't. Ready to find out what it is? After your blood test, thing 3. Write down what you did before the test, yes. Seriously? Now I know what you might be thinking. Come on, do I really need to write stuff down? I just went in, got my blood drawn, and that's that. But my dear friend, your memory might be good, but our bodies, especially at this age, can react in ways we don't always expect. And if something's off in your lab results, having a written note of what you ate, drank, or did the night before can make all the difference. Let me tell you a little story. A lady I know, 68 years young, went in for routine labs. Her liver enzymes came back unusually high. Her doctor was puzzled. She swore she hadn't done anything different. But then she remembered 2 nights before the test. She had a few glasses of wine at her granddaughter's graduation party. She didn't think it mattered. But it did. When she told her doctor, everything made sense. They waited 2 weeks, retested, and her results were totally normal. No liver disease, no panic, just timing. The Journal of Hepatology published a study showing that even moderate alcohol intake within 72 hours before testing can temporarily elevate liver function markers. Now imagine not remembering that and being misdiagnosed or sent to a specialist you never needed. That's why I always tell folks jot it down. Just a small notebook or a quick note on your phone. Had coffee at 7 a.m., took Tylenol last night, woke up at 3 a.m. and didn't sleep well. These things matter, trust me. Because if your results come back weird and your doctor asks, did you do anything different? You'll have the answer right there. No guessing, no stress, just clarity. And my dear one, if you think this little tip could save someone a whole lot of worry, would you help me spread it? Tap that like button. And tell me in the comments, have you ever forgotten something before a test and wished you'd remembered later? Now get ready, because next, we'll talk about something simple, free, and often ignored, yet it could make your blood test 10 times easier. Don't go anywhere. And my dear friend, if you're still here with me right now, it tells me something very special about you. It tells me you care not just about your own health, but maybe about someone else's too. And if that's true, I want to ask you for a little favor from the heart. First, would you take a second to hit the subscribe button? Just a simple tap, but it means you'll never miss the things we share here. Things that could change the way you grow old. Things that keep you sharp, steady, and strong. Second, please tap that like button if this message has given you even one useful thought so far. It helps the message reach more people who need it. Third, my sweet friend, type the number 2 in the comments below. That's our little code today. Just the number 2. That tells me you're not only here, you're tuned in. You're thinking, you're walking this path beside me. And finally, if someone pops into your mind right now, a friend, a neighbor, someone from church, your brother or your sister, please share this video with them. Post it in your WhatsApp group, on your Facebook, or just send it in a private message. Because maybe, just maybe, they've got a test coming up soon. And your simple share could spare them from stress, confusion, or even a dangerous mistake. Thank you for being the kind of person who stays, who listens, and who cares. After your blood test, thing 4. Drink water but skip the caffeine. Skip the booze. Now listen here, my dear friend. After getting your blood drawn, your body has just done something important. It gave up a little bit of itself so that we could peek inside and see what's going on. That deserves care. That deserves kindness. And one of the kindest things you can do for your body right after a blood test is to give it water, not coffee, not sweet tea, not a beer to calm the nerves, just water. I know how tempting that morning cup is, that warm mug calling your name. And I know some of us have the habit it's the first thing we do when we get home. But here's the thing. Caffeine and alcohol can both dehydrate you, and dehydration right after a blood draw can make recovery slower, and your energy crash harder. According to the National Institutes of Health, even mild dehydration can lead to dizziness, fatigue, and slower circulation, especially in older adults. And after a blood test, that's a recipe for feeling woozy, off balance, or worse. A 2022 study in the Journal of Geriatric Medicine found that seniors who rehydrated with plain water within 30 minutes of a blood draw reported fewer post-lab symptoms and faster recovery overall. So what should you do, friend? Keep it simple. Grab a glass of clean, room temperature water. Sip slowly. Let it replenish what you lost. Your veins, your heart, your kidneys, they'll thank you. Don't reach for that caffeine right away. Give your system a little time. Same goes for alcohol. Even a glass of wine at lunch can mess with how your body bounces back after a test. You've done something good. Now treat yourself with a little respect. And you know what, my dear one? If you've ever made the mistake of chugging a soda or downing a double espresso right after your lab appointment, don't beat yourself up. You didn't know, but now you do. And that means you've already taken the first step toward better care. If this speaks to you, I'd love to know. Hit that like button if you're learning something new today, and comment with a little hydrate and heal below so we can keep reminding each other. And now, let me ask you something. What if I told you that there's one thing you absolutely should not do for at least 12 hours after your blood test, but almost everyone does it anyway? That's coming next. You'll want to hear this. After your blood test, thing 5. Don't jump straight into heavy activity, even if you feel fine. Now listen close, my dear one. I know some of you are the tough it out type, the kind who think, I'm fine. I got my blood drawn. I feel okay. I'll go rake the yard, lift some boxes, maybe even take the grandkids to the park. I love that about you, that strength, that stubborn will to keep moving. But sometimes, that very strength can work against you. Right after a blood draw, your body needs to rebalance. You've lost a little volume. Your vessels are adjusting. And while you might feel okay at first, your blood pressure can drop suddenly, especially when you start moving fast or lifting heavy things. The American Heart Association notes that postural hypotension, or sudden blood pressure drops after sitting or lying down, is common in older adults, especially after fasting or blood loss, even minor. That's why folks sometimes feel that woozy spell even hours after the draw. I once had a friend, 72 years young, who felt just fine after his labs, drove himself home, no problem. Then decided to carry in all the groceries in one trip because, well, that's just how he rolls. He fainted in his driveway, hit his head, ended up needing stitches. And you know what he told me later? I wish I'd just sat down with a glass of water and let my body catch up. That's what I'm telling you now, my friend. Don't rush, don't push, don't prove anything. Sit down, rest. Let your body say thank you. Let the blood pressure stabilize. Let the vessels tighten up again. You're not being lazy. You're being wise. And if you've ever pushed too hard after a blood test, tell me in the comments what happened. Or just type, I'll rest next time so I know you're with me on this. And hey, tap that like button if you agree that being strong doesn't mean going fast. It means knowing when to slow down. Now here's a question most folks don't even think to ask. What should you do if your test results come back and you don't understand them at all? That's what we're going to talk about next. And trust me, you'll want to know before that call from the doctor comes in. After your blood test. Thing 6. Don't try to decode your results on your own. Now, my dear friend, this one might ruffle a few feathers, because I know we're smart. We've been through a lot in life. Some of us raised families, ran businesses, survived wars, heartbreaks, and hospital stays. So when the lab results show up on the computer or in the mail, it's only natural to peek, to try and figure it out, to play doctor for a minute. But here's the truth. Lab reports are not meant to be read like a recipe. They're not always straightforward. Sometimes a number that looks normal isn't normal for you. And sometimes a result that's marked high or low doesn't mean danger. It just means your body's reacting to something temporary. There's a beautiful piece of research from the Mayo Clinic proceedings that found over 65% of patients misinterpret at least one part of their lab results when reading them alone without context from a healthcare provider. That's more than half of us walking around stressed out for no reason. Or worse, thinking we're fine when we're not. Let me put it this way. Friend? Reading your labs without a doctor's guidance is like trying to read a map without knowing where you are. You could end up in circles or worse, headed the wrong way entirely. I once had a friend who saw her creatinine level was slightly elevated. She panicked, thought her kidneys were failing. Lost sleep for 3 nights straight before her doctor calmly explained that it was just a normal fluctuation from mild dehydration. So please, don't Google every number. Don't jump to conclusions. Instead, write down your questions, save your energy, and wait until you can talk to someone who knows your whole story, not just the numbers. And if you've ever stared at those lab results, heart pounding, trying to make sense of the numbers that was me in the comments. I know you're not alone. Tap that like button if you believe peace of mind is just as important as medical data. And coming up next, we're diving into something most people forget completely after a blood test. Yet it could make or break your next appointment. You ready? And now, my dear one, if what we just talked about made you breathe a little easier, if it reminded you that you don't have to carry the weight of every number, every chart, every medical term alone, then I'd love for you to walk with me a little further on this journey. First, would you hit that subscribe button? It means you'll never miss another story, another tip, another quiet truth that could save you or someone you love from unnecessary worry. Second, give that like button a gentle tap if you believe, like I do, that peace of mind is sometimes the best medicine. Third, drop the number 3 in the comments, just the number. It tells me you're here, you're tuned in, and that these words are finding a home in your heart. And lastly, my friend, if there's someone in your life who always checks their test results and spirals into panic, or maybe someone who doesn't check them at all, share this video with them. Post it in your Facebook group, your family thread, your church bulletin board, wherever your people gather. Because just one sentence, one reminder, might stop someone from misreading their own story. You have the power to ease someone's mind today. Isn't that a beautiful thing? After your blood test, thing 7. Think back to how you slept the night before. Now this one's sneaky, my dear friend. Most people don't even think about it. But I want you to stop for a moment and ask yourself, how did I sleep last night? Because believe it or not, your sleep, the night before your blood test can impact certain results, especially hormones more than you realize. Let me explain. Real gentle hormones like cortisol and testosterone, they run on a rhythm, like the tides, like the sun rising and setting. They peak in the morning, especially if you've had a good night's rest. But if you stayed up late watching TV, had a rough night tossing and turning, or woke up every hour thinking about your to-do list, that rhythm gets thrown off. According to the Endocrine Society, even a single night of poor sleep can reduce morning testosterone by up to 15% and elevate cortisol in a way that mimics chronic stress. That means your test results might say your levels are low, when in truth your body's just tired. I knew a man, strong fella, mid-60s, who went in for a testosterone check after a rough night on the road. He barely slept. His test came back low. Doc almost started him on replacement therapy, but something didn't feel right. They repeated the test after a full night's sleep. Boom, back to normal. So here's what I'm telling you. Dear heart, don't ignore your sleep. If you didn't rest well the night before, tell your doctor. They need to know. It might explain a number that looks strange, and it might save you from going down a path you don't belong on. And if this made you think, wait, Maybe that's why my last test seemed off. Tell me in the comments. Just type sleep matters so we remind each other how connected everything really is. Tap that like button if you believe rest is just as important as medicine. And if you're learning something new today, don't keep it to yourself. Share this with someone who's been dragging themselves into labs half awake, thinking it doesn't matter, because now we know better. And coming up next, we're diving into something a little more personal. What you might not be telling your doctor that could change everything. Stick with me. After your blood test, thing 8. Tell your doctor everything you're taking, even the things you don't think count. Now lean in. Friend, this one's real important. So many of us think, well, I told my doctor I take my blood pressure meds. That's all they need to know, right? But let me ask you something. What about that supplement you picked up at the grocery store for your joints? What about the little blue pills from that men's clinic downtown? Or the weight loss drops your neighbor gave you last summer? You see, my dear one, the body doesn't care where a pill came from, whether it's from your pharmacy, a vitamin shop, or something you ordered online. If it goes in your body, it shows up in your labs, and if your doctor doesn't know about it, they might misread the results completely. A study from JAMA Internal Medicine found that nearly 1 in 4 older adults takes at least one supplement or alternative therapy they don't report to their physician. That's a quarter of us walking around with lab results that don't tell the full story. I once knew a man who was sent to a hematologist, a blood specialist, because his red blood cell count was sky high. They feared a bone marrow disorder. But turns out he was on testosterone pellets from a clinic and never told his primary doctor. That one detail could have saved him weeks of worry and hundreds of dollars. So here's what I ask of you. Before you see your doctor to review labs, make a full list of everything you're taking. Vitamins, creams, herbal teas, over-the-counter meds, patches, oils, all of it. Nothing is too small to mention. You'd be amazed how one tiny truth can clear up a whole lot of confusion. And if this opened your eyes a bit today, tap that like button. Then type the word honesty heals in the comments because it truly does. And if you know someone who's quietly taking something they never told their doctor about, share this with them. It could save them from a wrong diagnosis or worse. Now, what if you've just started a new medication and then go back for labs too soon? Could that mess with your results? The answer is yes, and we're going there next. After your blood test, thing 9. Don't go back for labs too soon after starting or changing a medication. You know that feeling, my dear one, when you just started a new pill, or the doctor adjusted your dosage, and you're anxious to see if it's working. So what do? We run back to the lab a few days later, hoping for answers. But here's the truth no one tells us. Your body needs time to adjust, and jumping into labs too early can paint the wrong picture. Let me explain. Most medications don't work overnight. Whether it's a thyroid pill, a blood pressure med, or something for your blood sugar, your system takes time to respond. And if you test too soon, the results might look like the medicine isn't helping. Or worse, they might make your doctor think the dose is too low or too high and lead to another adjustment that wasn't even necessary. According to the American College of Physicians, it can take 6 to 8 weeks for certain medications like levothyroxine or statins to fully stabilize in your system. Testing before that window closes may show incomplete effects. I had a friend, sharp guy, 67 years old, who started a new diabetes med. 1 week later, he got his labs drawn. His numbers hadn't moved much yet. His doctor raised the dose. The next test, his sugar crashed. Turned out, the first dose was already working, it just hadn't had enough time. So please, my dear friend, be patient. Let your body catch up before jumping to conclusions. Follow the timeline your doctor gave you. Ask questions like, when's the best time to check if this is working? That one question could save you from bouncing between doses and side effects for no good reason. And if this reminded you of a time when you rushed back to the lab too soon, leave a little. I've done that in the comments, so others know they're not alone. And hit that like button if you agree that timing is everything. And now, my friend, we've come to the final thing, and it's one most folks never think about until it's too late. It has to do with the timing of your appointment and your lab results. And it could change how your care is delivered. Don't miss it. After your blood test, thing 10. Don't wait until the last minute to get your labs done before your doctor's appointment. Now this one, my dear one, it's so common and yet so easy to avoid. You've got a follow-up appointment coming up. Maybe it's next Tuesday. So you think, I'll just get the labs done on Monday. That should be enough time, right? But what happens next? The lab results aren't ready. Some are still pending. And your doctor walks into the room with only half the picture in front of them. Sound familiar? I've seen this happen more times than I can count. Appointments wasted, decisions delayed, and even worse, a serious issue hiding in those pending labs that nobody catches in time, all because the blood work came in too late. According to the American Journal of Medicine, nearly 30% of delayed diagnoses in older adults happen due to incomplete lab data at the time of the visit. 30%, friend. That's not a small number. That's missed chances. That's time lost. Let me tell you a story. A woman I once knew waited until the day before her visit to get her labs done. When she arrived, her doctor said, "We'll have to reschedule once the results are in." She felt fine, so she didn't worry. 3 days later, the labs came back showing a rapid drop in kidney function. But now the doctor was booked out for weeks. That delay, it mattered. So please, my friend, get your labs done early. Give them time to come back. Even if you think, it'll be fine, give yourself the buffer, because the sooner you and your doctor have answers, the sooner you can make the decisions that matter. And if you've ever been in that spot sitting in the office, waiting on missing results, leave a comment with "never again." Let's make a pact to take back our time. Tap that like button if you believe your health is worth the extra planning. And if this video has helped you see blood tests in a whole new light, just wait till what's coming next. Because, my dear friend, now that we've talked about what to do before and after your blood test, what if I told you there are 10 mistakes most people make right before the needle even touches their arm? And worse, most of us are still making at least one of them. Every single time. Are you ready to uncover them? Before your blood test, mistake 1. Thinking fasting means just no food, my dear one. This is by far the most common trap. You're told to fast, so you skip breakfast. You don't eat anything after dinner. You think, done. I've fasted. And technically, yes, you haven't eaten. But that's not the whole story. Let me ask you something. Did you have coffee this morning? Just black coffee. Maybe with a splash of cream? Or a little sugar? Or maybe you chewed a piece of gum? Popped a mint to freshen your breath before the lab? You might not think that counts, but it does, and it could throw your test results completely out of whack. You see, true fasting means water only. No coffee? No tea? No juice, no chewing gum, not even a tiny mint. Anything with flavor, sweetener, or calories, even just 5 or 10, can kickstart digestion, stimulate insulin, and elevate your glucose and triglyceride levels. That means you could look pre-diabetic when you're not, or your cholesterol could appear worse than it really is. The American Diabetes Association reports that even black coffee can raise blood sugar levels in fasting individuals, especially in older adults. Not because of sugar, but because of how caffeine affects insulin sensitivity. I knew a man, proud and sharp, who swore he was fasting properly. His blood sugar came back high. The doctor almost put him on meds. Later, it turned out he'd had a small coffee with cream that morning. Just 1 cup. That one mistake could have changed his whole life plan. So please, my friend, when they say fasting, they mean it. Water only. And if you're ever unsure, call your doctor. Ask the lab. Double check. It's better than guessing and risking everything. And if this hit home for you, do me a favor, hit that like button and comment below with the words "no coffee" next time so we can remind each other. Then take a moment to share this with someone in your life who swears that a little sip won't hurt. Because now you know it just might. And speaking of fasting, what happens when you go too far? What if you fast too long? Or skip the pills you're supposed to take? That's the next mistake, and it's one that could land you right back in the hospital. Before your blood test, mistake 2. Fasting too long or skipping your medications just in case. Now listen, my dear one. We all want to do the right thing. We want our test to be clean, perfect, undisturbed. So what do some folks do? They fast for 16, 18 hours instead of 8. They skip all their pills just in case it messes up the test. And I get it. But here's the hard truth. Overdoing it can be just as dangerous as not fasting at all. Let me tell you what happens when we take it too far. When you fast longer than your doctor recommends, especially if you're on medication for blood sugar, blood pressure, or seizures, you're not just changing the lab result. You're putting yourself at risk. Skipping your meds can cause your sugar to crash, your pressure to spike, or even trigger a seizure. The American Academy of Family Physicians warns that older adults are more likely to suffer complications from medication withdrawal, even if it's just one missed dose, especially for drugs that control the heart, brain, or metabolism. I had a neighbor once, sweet old soul, who skipped his morning blood pressure meds before a lab draw. Didn't want to mess with the numbers, he said. That morning, his pressure shot up to 190/100 in the waiting room. He had to be rushed across the street to the ER. All that stress, all that danger just because he wanted a clean test? Here's the truth, my friend. You don't need to skip your medications unless your doctor tells you to. Some meds must be taken even on the morning of your blood test. Others might need to be held, but that's a decision your doctor makes, not Google, not your cousin, not guesswork. So please, talk to your provider. Ask, should I take my morning meds? Don't assume, because guessing with your health? That's one risk we just can't afford. And if this made you think, oh no, I've done that before, you're not alone. Type never skipping meds again in the comments so we can all keep each other on the safe path. And tap that like button if this reminder came at just the right time. Because up next, we're going to talk about something that seems healthy but can totally mess up your lab numbers if you do it too close to your test. Think sweat. Think muscles. Think trouble. Before your blood test, mistake 3. Exercising right before your labs thinking it's healthy. Oh, my dear friend, I know you mean well. You woke up early. Maybe you took a brisk walk, lifted a few weights, did a little stretching or cycling. You thought, let me get the blood flowing. Burn some calories before my test, it'll help my numbers look better. And I admire that motivation, I really do. But the truth is, exercising too close to your blood test can actually do the opposite. When you work out, especially with strength training or intense cardio, your muscles break down slightly, as they're supposed to, but in the process, your body releases creatine kinase CK and other enzymes into your bloodstream. It can also raise creatinine, which is used to estimate kidney function. Now, imagine your doctor reading those results. Elevated CK. Could look like muscle damage. High creatinine. Might suggest poor kidney health. All because you did a few squats and push-ups that morning. According to the Clinical Journal of the American Society of Nephrology, vigorous physical activity within 24 hours of a blood draw can lead to misleading kidney and liver test results. Especially an older adult. I once knew a gentleman fit as a fiddle, proud of his morning routine. He did a full workout before his labs. The results came back showing possible kidney disease. His doctor sent him to a nephrologist. Turned out, just post-exercise creatinine spikes. Weeks of stress for nothing. So here's the lesson, dear one. Rest the day before your test. No weightlifting. No long power walks. Let your body settle. Let your numbers reflect your baseline health, not your post-workout state. And if this sounds like something you've done before, don't feel bad. Just type rest before the test in the comments to remind yourself and someone else. Give that like button a gentle push if today's truth gave you something new to think about. And share this video with that friend of yours who always says, no pain, no gain, because sometimes no rest means false alarms. Next, we're going to talk about something far simpler but just as risky. It's something you don't drink enough of, and it can make getting your blood drawn a whole lot harder than it needs to be. Before your blood test, mistake 4, not drinking enough water before your lab appointment. Now I know, my dear one, you've been told to fast, and so you fast, no food, no drinks, nothing at all. You think, better safe than sorry. But here's the part, no one tells you most fasting blood tests still allow water, and not drinking it, that's where trouble starts. You see, when your body's dehydrated even just mildly, it changes the way your blood behaves. The veins become smaller. The blood itself becomes thicker, more concentrated. That makes it harder to draw, harder to test, and harder for your results to reflect what's really going on. The Mayo Clinic reports that dehydration can falsely elevate blood urea nitrogen BUN, creatinine, sodium, and even glucose levels, leading to misinterpretation of kidney function and electrolyte balance. In other words, your labs may scream problem when it's really just a thirsty body crying out for help. I had a dear friend early 70s who showed up to his lab completely dry. No water since the night before. The nurse poked him 3 times and still couldn't get a proper draw. His labs came back showing possible kidney stress. Turns out, he was just dehydrated. So let me tell you this gently, but clearly, unless your doctor says no fluids at all. You should absolutely drink water before your test. Not gallons, just a glass or two the morning of. Room temperature. Sip slowly. Let it nourish your body from the inside out. And if you're not sure whether your test allows water, call the lab. Call your doctor. Ask. It takes 30 seconds to confirm and could save you days of confusion. If you've ever shown up dry as a desert and regretted it, leave a comment below that says hydration is preparation. And give that like button a little love if you agree that clear answers begin with a clear bloodstream. Next, we're going to talk about timing, and I don't just mean the clock. What if you've been sick recently? Or just got back from a wild weekend? Is that the best moment to get your blood drawn? Let's talk about it next. Before your blood test, mistake 5. Getting labs done right after a wild weekend, illness, or unusual event. Oh my dear one, let's talk about timing. Not the kind you read on a clock, but the kind your body feels. Here's the truth. Your body reacts to everything you do, whether it's a night of drinking, a rough stomach bug, or even just a cruise vacation where you lived like you were 25 again. And when you get blood drawn right after something out of the ordinary, those results might reflect the moment, not your real, everyday baseline health. Let me give you an example. A gentleman I knew, healthy as can be, came back from Vegas, celebrated his anniversary, ate rich food, drank a little more than usual, danced till midnight. 2 days later, he had his cholesterol and liver panels drawn. The labs came back messy. Liver enzymes high, triglycerides through the roof. His doctor looked at him, concerned. What's going on? The truth. Just a party weekend. But without knowing that, the labs looked like a problem. The American Journal of Clinical Pathology confirms that even moderate alcohol use or acute illness within 72 hours can skew test results, especially liver function, glucose, and lipid profiles. And it's not just alcohol. Even a short-term infection like bronchitis or a round of antibiotics can temporarily affect your white blood cells, liver enzymes, or kidney function. So here's my gentle advice, dear one. If you've just been sick, if you've just come back from vacation, or had a few drinks more than usual, wait a few days. Let your body find its rhythm again. Let your numbers speak true, not just temporary chaos. And if your test was meant to check how something like a medication affects you during that time, sure, do it. But if not, wait until your system settles. If this makes sense to you, tap that like button and type timing matters in the comments. And send this to someone in your life who always schedules their labs right after a holiday, thinking it won't matter. Because next, we're diving into one of the sneakiest lab disruptors of all time. It's tiny. It's over the counter. And it's hiding in your hair, skin, and nail vitamins. Can you guess what it is? Before your blood test. Mistake 6. Taking Biotin vitamin B7 before your test without telling your doctor. My dear friend, this one might surprise you. You see, many of us take supplements, a little something for the joints, a soft gel for the heart, a daily multivitamin for peace of mind. And then there's Biotin, also known as vitamin B7, a common ingredient in hair, skin, and nail supplements. Seems harmless, right? But here's the twist. Biotin doesn't hurt your body, but it can totally mess up your lab results. Biotin interferes with the very tests we use to check your thyroid levels, especially TSH, thyroid-stimulating hormone. It binds to the tools used in certain lab machines, throwing off the readings. That means your TSH might look low, when it's actually just fine. Let me say that again. Just so it sinks in, you could be told your thyroid is overactive, or that your medication dose is too high, all because of a vitamin you thought was helping you. The FDA issued a warning that biotin can cause clinically significant interference in blood tests, leading to misdiagnosis or improper treatment decisions, especially in tests related to hormones, cardiac markers, and thyroid function. I knew a woman once who was taking a beauty supplement every morning. Nothing extreme, just a simple capsule. Her doctor later lowered her thyroid medication because her labs showed a drop in TSH. Weeks later, she was exhausted, foggy, and struggling to function. The labs were false. Her thyroid wasn't overactive. The biotin masked the truth. So here's what to do. My dear one, if you're taking biotin, stop it at least 2 to 3 days before your lab test. And more importantly, tell your doctor. Let them know. Don't keep it secret just because it's not a real medicine. Anything that affects your body, affects your lab, If you've ever taken a supplement and thought, it's just vitamin, what's the harm? This is your wake-up call. Comment "No more biotin" before blood work below to help others remember. Tap that like button if this is the first time you've ever heard of this hidden truth. And share it with someone you know who loves their skin, hair, and nails but doesn't realize the cost of getting it wrong on test day. And up next, we're entering sensitive territory, hormone testing. What time you show up at the lab could be the very reason your testosterone or cortisol looks low when it's not. Let's talk about it next. Before your blood test. Mistake 7. Getting hormone labs at the wrong time of day. My dear friend, you've made the appointment. You're ready to get your hormone levels checked. Maybe it's testosterone, maybe cortisol, and you think, I'll stop by the lab after lunch, after running a few errands. What's the difference? Well, the difference could be everything. Hormones, you see, are not like cholesterol or blood sugar. They rise and fall naturally depending on the time of day. Your body runs on a rhythm, a clock that isn't on your wrist but in your brain. And for hormones like testosterone and cortisol, the timing of your blood draw can completely change the story your results tell. Testosterone, especially in men, peaks early in the morning, usually between 7 and 10 a.m. After that, it starts to fall. So if you show up at 2 in the afternoon, you might see a number that looks low, but really isn't, and suddenly, you're being told you have low T, when in fact you were just tested at the wrong hour. Cortisol works the same way. It's highest when you first wake up, preparing your body for the day ahead. If a doctor is checking for deficiency, they'll want to see that morning spike. But if they're checking for excess, like in Cushing's syndrome, they'll need a nighttime sample, sometimes even at midnight. A study in the Journal of Clinical Endocrinology and Metabolism confirmed that testing testosterone outside of early morning hours can lead to up to a 30% underestimation in older adults. I knew a man, early 60s, still strong and vibrant, who was told his testosterone was dangerously low. He was devastated. But guess what? His test was done at 3 p.m. After a night of poor sleep. They redid the test the next week at 8 a.m. Well rested. His levels were completely normal. So here's what I ask. Dear one, if you're getting hormone labs, go early and go rested. Don't pull an all-nighter before. Don't show up groggy after a red-eye flight or a sleepless night. And if this was news to you, if no one ever told you that timing could change a diagnosis, tap that like button. Then drop the words "morning" means accurate in the comments to help others remember. Next up, we're going to talk about honesty. Not with your spouse, not with your accountant, but with your doctor. Because there's something many people don't tell their provider, and that silence, it could cost them the truth. Before your blood test. Mistake 8. Not telling your doctor about everything you're taking, including meds from clinics, online sources, or supplements. Now lean in, my dear one. This one's personal. Because so many of us have done it without even thinking twice. We tell our doctor about the prescriptions from the pharmacy, the official stuff, but what about the other things? The testosterone pellet from that men's clinic, the fat burner drops from an online ad, the natural energy booster your friend gave you at church, the supplement your cousin swears by. You may think, it's just something I tried, no big deal. But it is a big deal because anything you put in your body can affect your blood work. I once met a man in his late 60s. His doctor noticed his red blood cell count was unusually high, like bone marrow disorder levels. They sent him to a hematologist. He was terrified. Weeks of worry. And only later did he admit he'd been getting testosterone pellets from a local clinic, something he never told his primary care doc. You see, testosterone therapy is a well-known cause of elevated red blood cell counts. Had the doctor known, they would have interpreted his labs completely differently. But silence led to unnecessary fear and a specialist referral that could have been avoided. The Annals of Internal Medicine found that over 35% of patients over 60 failed to disclose at least one medication or supplement to their doctor, often because they didn't think it mattered. But friend, it matters. It matters more than you know. Because your doctor can only interpret your labs based on what they think you're taking. If you leave something out, even by accident, it's like asking them to read a mystery novel with the last few pages missing. So here's what I lovingly ask. Make a full list. Write it down. Bring it to your appointment. Pills, powders, patches, sprays, shots if it goes in or on your body. It goes on the list. And if this opened your eyes today, do something kind. Tap that like button and comment. Full honesty. Full health below. And if you know someone who's quietly taking something they never told their doctor about, share this video with them. It could save them from a misdiagnosis, a wrong prescription, or even a hospital visit. Next, we'll talk about something that seems smart, but might backfire. It's about retesting your blood too soon after starting a new medication. Is it helping? Or are you just seeing half the story? Let's clear that up next. Before your blood test. Mistake 9. Doing your labs too soon after starting or changing a medication. Oh my dear one, this one is so easy to fall into. You start a new pill maybe for blood sugar, thyroid, cholesterol, and just a few days later, you think, let me get my labs done. Let's see if it's working already. I understand that. We all want reassurance. We want proof. We want to feel in control. But here's the truth. Your body isn't a light switch. It's a symphony. And new medications take time to tune. When you test too early before your medication has had a chance to settle, you're often not seeing the real effect. You're seeing an echo, a transition, a half-finished song, and that can lead to confusion. Your doctor might think the med isn't working, or think it's working too well, and that can lead to changes that aren't just unnecessary but risky. The American College of Physicians states that many medications require at least 4 to 8 weeks to show full therapeutic effect in labs, especially for thyroid hormones, statins, and diabetes meds. I remember a gentleman, a quiet, thoughtful man who was put on a new thyroid dose. 1 week in, he got his blood drawn. The results were erratic. His doctor lowered the dose. A few weeks later, his energy crashed, his mood tanked. Why? Because the first dose had been right, he just didn't wait long enough to let the full effect show. So, my dear friend, please trust the timeline your doctor gives you. If they say, let's check this again in 6 weeks, hold that line. Let the medicine do its quiet work before trying to measure it. And if you've ever been guilty of peaking too soon, tell me in the comments. Next time, I'll wait. And hit that like button if you believe that sometimes the hardest thing is the wisest thing, being patient. Now, we've come to the final mistake, the one that seems harmless, even logical, but it might be the reason your doctor walks into the room with an empty chart. Let's talk about it because it could be the one thing delaying your care right now. Before your blood test. Mistake 10. Waiting too long or doing your labs right before your appointment. My dear friend, this is one of those mistakes we all make because life gets busy. You've got a doctor's appointment coming up. Maybe it's in a few days, and you think, I'll go get my blood drawn the day before or maybe even the morning of the visit. That should be fine, right? But here's what happens. The results aren't ready yet. The labs are still processing. Your doctor walks into the room without the full picture, maybe with no picture at all, and what should have been a meaningful conversation about your health turns into a guest, a delay, a wasted visit. The American Journal of Preventive Medicine found that 30% of follow-up visits are compromised due to incomplete lab data, often because patients did their blood work too close to the appointment date. That's nearly 1 in 3 visits where answers are missing when they matter most. I knew a woman gracious, responsible, always on time who scheduled her labs the day before her appointment. When she arrived, only half her tests were ready. Her doctor couldn't make any decisions that day. We'll follow up later, he said. But that later turned into 2 more weeks of waiting, worrying, and wondering. Here's what I gently suggest. Dear one, do your labs 4 to 7 days before your appointment. Give the system time to process. Give your doctor time to review. That way, when you sit down face to face, you're not both staring at blank pages. You're looking at your truth together. And if you've ever walked into an appointment only to hear, we're still waiting on your results, type, no more last-minute labs in the comments so we can remind each other. Hit that like button if you agree that answers delayed are care delayed. And if you know someone who always cuts it close, forward them this message. It might be the nudge they didn't know they needed. Now, my dear friend, we've made it. You and I. 10 mistakes revealed, 10 truths uncovered. But stay with me because what comes next is more than science. It's a reminder, a truth beyond numbers, a message from one heart to another. My dear friend, if you've made it this far with me, it tells me something beautiful about you. You care. You want to understand your body. You want to get it right, not just for the numbers, but for the life behind those numbers. The truth is, you don't need to change the whole world. Just avoid a few simple mistakes and repeat a few kind habits day by day. That's how you protect your health. That's how you stay steady, sharp, and strong. There's a saying I love: the best time to plant a tree was 20 years ago. The second best time is today. Let this be your today. And if this video gave you even one insight, please leave me a comment. Let me know what surprised you most. Tap that like button to help more people our age discover truths that truly matter. And don't forget to subscribe so we can keep walking this road together day by day. Heart to heart, share this video with someone you love. You never know, your one small action might be the very thing that saves someone from a wrong diagnosis or gives them back the peace they've been missing. Take care, my friend, and I'll see you in the next one.